Upton. BBC CWR.
This morning, the people of Leicester are waking up to the news that their city is being forced back into lockdown for at least another 2 weeks. Health Secretary Matt Hancock explained the shutdown to the Commons yesterday and that this decision would now, like I say, be reviewed in a fortnight.
The more people follow the rules, the faster we'll get control of this virus and get Leicester back to normal. We'll keep all of these local measures under review, and we will not keep them in place any longer than is necessary. We'll review whether we can release any measures in 2 weeks' time.
Professor Brian Ford is a microbiologist responsible for introducing biohazard law. It governs the safe handling of viruses, and it's his practices on this that have been adopted worldwide by countries in tackling viruses. Professor Ford, very good morning to you.
Morning to you too.
Thanks for joining us on BBC CWR. Have the government done the right thing in enforcing this lockdown with Leicester?
Well, yes. I'm not sure they've done the right thing ever since it started. If you must remember, back in the middle of March, it was exactly when the World Health Organization said we now had a pandemic that the government decided to stop tracking and tracing. That was the very time to keep it going. So that was when, in essence, the government lost control of the situation. But you see, you've got these outbursts like your local hospital, the George Eliot, isn't it, where you've had so many deaths. I mean, one's heart goes out
25 deaths in a fortnight at the George Eliot in Nuneaton. Yeah.
One's heart goes out not just to the families of people who have died, but to the families and the people who haven't, because this virus very often causes debilitating long-term effects, and the amount of suffering is extraordinary. I was actually thinking whether we've actually handled the whole of the business of cross-infection in hospital wrongly. For example, this PPE saga, the gowns and things people use, they use them for a little while, and then they're destroyed, they're burnt. The effect on the environment is catastrophic. But this virus is inactivated at 60 degrees Celsius. So if you were just to slightly iron the clothes or put them in a chamber at 70 degrees, the virus would be inactivated and you could use them all again.
Yeah, okay.
We also use, rubber gloves. But once a bacterium is on rubber gloves, it'll stay there. The whole point of latex gloves is to peel them off and throw them away. I'm beginning to think that cotton gloves would make more sense, because viruses are rarely transmitted on cotton. And if customers going into shops wore cotton gloves, for example, they could handle the clothes and the jewellery with no trouble at all. So it may be that in many ways we need to stop and rethink our procedures.
Okay. And in terms of this outbreak, and I appreciate you bringing up the George Eliot in Nuneaton, and looking at these numbers, as a microbiologist, Professor Ford, the numbers that we're talking about here, 869 positive tests in a 2-week period. Coventry has had 843 in the whole of the pandemic so far. That's clearly a spike. What, as a microbiologist, would you be looking at that's caused that, do you think?
Well, so far as the country as a whole is concerned, as I say, I think we might need to rethink the way that we actually handle it in general.
Right.
Leicester is an interesting case in point, because Leicester is exactly one half white and one half of immigrant origin. And many of those communities maintain a very closed and family-orientated societal structure. And it could be that people don't actually understand, don't follow, or don't wish to follow some of the procedures that other people are doing. There's always a danger, you see, if you come from an immigrant background, that you live within your own culture and you feel safe and secure in that, and you don't really want to be influenced by what other people are doing. So it could be that there is a disregard of some of the safety measures in a big chunk of the community.
And again, there's no evidence of that just yet, but there's also evidence that does show that a lot of immigrant communities, and certainly black and multi-ethnic populations, are more likely to be employed within the National Health Service in some of these jobs, auxiliary jobs within hospitals, where potentially they could catch infections, transfer infections, be around infectious atmospheres. It's again the population you spoke of there that is more at risk because of that, isn't it?
Very much. I've always been astonished. I mean, I've had relatives who end up in care homes. I've always been astonished at the way in which carers are always so underpaid. The reason they're underpaid is because people get away with underpaying them, because, of course, caring is something that you do from the heart. It's something that you're devoted to. And I have known so many black carers who are the most adorable, hard-working people you could possibly imagine. And they do it because the whole culture is to care for others and to look after other people. And yet, because they like doing it, we get away with paying them rock-bottom money. And it is absolutely true that there is in many of the different cultures that were not necessarily brought up for generations in this country, that have retained a wish to care for others, particularly to care for older people, that we as white English people have very often forgotten about and lost, and we don't do anymore.
Okay.
And it is terrifying, to my mind, to think that so often we fall back on people who've kept a better culture, a better sense of caring, and in so many ways we denigrate what they do, we look down our noses at what they do, and we don't reward them as we should. In fact, I mean, being a carer is almost the same as being a nurse, isn't it? It's one.
It is why the clap for carers was so cool, wasn't it? It wasn't
Absolutely,
just about nurses; it was about all those people you've spoken of. Professor Ford, I've got to leave it there, but really appreciate your thoughts this morning, and obviously your expertise in this area. Professor Brian Ford, retired microbiologist, and calling into question there a lot of the government's processes so far, why it stopped test and tracing as early as it did, the whole PPE scandal, which of course we heard about for a week on end, didn't we, at what point? So we're going to talk a bit more about this. And particularly an hour ago, I spoke to Professor Brian Ford, a retired microbiologist. He's the guy who's put together effectively the World Handbook in biohazards and how to handle viruses across the world. And he explained to us some of his ideas for stopping the spread and stopping these spikes like the one we've heard about in Leicester.
This virus is inactivated at 60 degrees Celsius. So if you were just to slightly iron the clothes or put them in a chamber at 70 degrees, the virus would be inactivated and you could use them all again. We also use, rubber gloves. But once a bacterium is on rubber gloves, it'll stay there. I'm beginning to think that cotton gloves would make more sense, because viruses are rarely transmitted on cotton. And if customers going into shops wore cotton gloves, for example, they could handle the clothes and the jewellery with no trouble at all. So it may be that in many ways we need to stop and rethink our procedures.
Rich and Rach, regular listeners, I know, dairy farmers. Phil, hope you're well. Can you try and get some clarity on the Leicester lockdown for us? We're an LE postcode. Can't find out if we're in lockdown or not. I've heard the Mayor of Leicester interviewed on the BBC.